I was American born, and I'll die in America.
Welcome to our group. Welcome to Defender 7 has so much knowledge, and this ought to show it right here.
Do you or someone you know suffer from depression? If so, please contact the National Suicide Prevention Lifeline at 1-800-273-8255.
Good evening and welcome to the Defender 7 Medical Tuesday night broadcast with your host, our Colonel Kimberly Purvis. Now, before we get on with our show tonight, I need to read our disclaimer. For those of you new just tuning in, the views and opinions expressed on Defender 7 radio show and Facebook page are those of the callers and or authors and do not necessarily reflect the official policy or position of the Defenders 7. Now, that being out of the way, welcome everybody. If this is your first time, I'm the General of the Defender 7, and I'd like to welcome you personally to our show. Always put on a good show, and especially our Medical Tuesday night broadcast. Our Colonel, our National Medical Officer, Kimberly Purvis, is doing a bang-up job with all the shows that she's produced. Now, with that being said, I'm not going to go into my normal long speech. Just please enjoy, and I am now bringing our Colonel, Kimberly Purvis, and turning the mic over to her. Good evening, Kimberly.
Good evening. How's you?
Good. Guess who's sitting here with me?
I don't know.
Guess who's? Take a wild guess.
Your daughter? In
no,
your house?
She's always here.
Oh, okay. I have no idea.
Take a wild guess. It's somebody that hasn't been around in a while.
Anjaho?
You got that right, Anjaho.
Well, you said it's your house. I said, that can't be Hinkle. So.
Well, he just said you're lucky his phone's not charged.
Hey, I'm not the one who came up with that name.
Tonight's show is on hemorrhage.
Yeah. Hemorrhaging, yeah. We could do hemorrhaging of blood or money, whatever the difference. I think we're doing both right now.
Blood or money. Right?
Yes, our country's hemorrhaging money left and right. Well, today I had my MRI on my knee, so I will know what the hell's wrong with it by Friday. So I know there's something wrong with it. She just couldn't tell me what.
Yeah, it's called old age.
No, funny. I wish, but no.
Her knee.
I wish.
Yeah. She doesn't say hi to her knee enough.
To what?
You don't say hi enough to your knee much.
Yeah, sure. All I know is...
Ooh, Angelo just said, and you shouldn't use them so much.
Yeah, well, I wish. I can't even say that. So, yeah.
Oh, shit.
Uh-huh.
And we have Captain from Wisconsin, Lorna Munson.
Wisconsin.
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 The AKA
Maria on
Slacker.
yet, or is she on yet, or
What?
she
No, Slacker's
What?
the one that came on so far.
Okay. Well, I know we've. Do what?
Sit the hell down. You sit the hell down.
Stephanie, get him.
Get him, Stephanie.
Get out!
And Lorna's on. Hey, Lorna.
Hooters,
Yeah.
stop it!
No.
Hooters, get off!
All right, we have a show to do here, folks.
Yeah, I know. I'm just waiting for the So we're going to do hemorrhaging. I know we've done it once before, but it's always good to know, and whatever may save a life one day.
We're doing what?
So hemorrhaging.
Oh.
Like hemorrhaging money, like our country's doing. But no, I'm doing it as hemorrhaging of blood.
Yeah.
So hemorrhaging or bleeding refers to blood escaping from the circulatory system. And a hemorrhage may be external and visible on the outside of the body, or it can even be internal, where there's no bleeding outside the body. Like a blunt force trauma to the abdomen or even to your head can cause internal bleeding. And it can occur at almost any part of the body. So internal bleeding occurs when there's a damaged vessel or organ. External bleeding is generally through a break in the skin, or a rupture, a cut, a gash, anything that breaks the skin open. And it can also occur when internal bleeding exits through a natural orifice, such as your mouth, nose, anus, vagina. They forgot eyes and ears, because you can bleed out of your eyes and ears too. Hemorrhage and stomach cancer. Oh, they have a video. So, Lorna, if you want to watch it, they have little videos. No pictures.
Oh, dang.
I know. So there's different types of hemorrhaging. And this is according to, this is on the WHO scale. So grade 0 means no bleeding. Grade 1 is petechial bleeding. And that's like, there's tiny, tiny little red dots that you could get, say if you're choking or someone chokes you, whatever. Usually you get them around your eyes, but you can actually get those pretty much anywhere on your body. But that's grade 1 hemorrhaging. Grade 2 is mild but clinically significant. Grade 4, and there's no grade 3, I don't know why. Grade 4 is severe bleeding, and that requires a transfusion. Sometimes with something like that, you could actually rupture your spleen, your liver. Trying to think of, those are the two main, that will bleed a lot. Grade 5 is severe, and that's associated with a fatality. So depending on the bleeding will depend on where it's caused. So there's arterial bleeds, and an arterial hemorrhage is recognized by the bright red blood. And it spurts like a jet, which rises and falls in time with the pulse. So every time your heart beats, the blood will pump out if it's a small enough hole or whatever in your body. In protracted bleeding, and when quantities of intravenous fluids other than blood are given, it can become very watery. So I'm sure everyone has seen blood. And when you water it down, it's not as bright red.
Not me. I've never seen blood.
You've never seen blood, huh? Okay, let me say profuse bleeding. How about that? You could actually, and I swear to God, paper cuts bleed like a sieve. I don't know why.
Yes.
Yes, they do.
And they're just right there on a couple little layers deep of skin, and they'll bleed. You just bleed and bleed and bleed. You're not gonna bleed to death, but you feel like it.
When I almost cut
Also,
my thumb off. When I almost cut my thumb off, the one kid said my blood was squirting up over the top of the tables.
Now that's because that's why it's called, like I said, with the arterial bleeding. Every time your heart, you have a heartbeat, the blood will like spew out like a little jet, like a water hose. And that's because of the heartbeat. Venous hemorrhage is a darker red. It's a steady and copious flow. Blood loss is particularly rapid when large veins are open. Henceforth, that's why it's capillary is the smaller. And actually, they have this backwards. Capillary hemorrhage is a bright red. It's often rapid, but it oozes. There's no. Sorry for the words I got to use, but so you could also have bleeding after surgery, and usually everybody does, depending on the surgery type that you had. So the primary hemorrhage, it occurs at the time of the injury or the operation. And reactionary hemorrhage it may follow the primary hemorrhage, usually within 24 hours, usually within 4 to 6 hours, and it's usually mainly due to rolling of a ligature, dislodgement of a clot, or a cessation of reflex vasospasm. Now, like for instance, like when I had my hysterectomy, I actually had internal bleeding and had a massive hematoma, but it took like 3 days for that one to form. So, and it was very painful, even though it was just sitting there in my abdomen. It can be very painful. Secondary hemorrhage occurs about 7 to 14 days and is due to infection and sloughing, and that just means it's coming off. The sloughing of the whatever is inside the where you had the surgery. The pressure of a drainage tube, a fragment of a bone, and a ligature in an infected area, or even cancer can cause hemorrhaging. So, and that's also like with the drain tubes. They're called JP drains, or Jackson Pratt, and it looks honestly like a little hand grenade. Is what it looks like, and they're hollow, and you have to open the little drain spout on it to push it up to get the air out, so it can pull any excess blood that's from surgery or anything like that. They still do use them. I know a lot of hospitals have different things to use for drainage. So depending on their presentation, hematemesis just means you're vomiting blood. It can happen. That's going to be from your stomach. You can have stomach ulcers. You can have stomach cancer. Various reasons to why you'd be vomiting blood. Hemoptysis, which just means coughing up blood from the lungs. The thing about that is you can also cough so hard that you'll actually make little tears in your throat. So I'm sure if anyone's had pneumonia, pleurisy, a severe respiratory infection probably has done that. But the coughing up blood is a lot. It'll be a lot of blood. Sometimes TB patients will cough up blood.
So my question is like, okay, what can you do about this stuff?
Go to the ER. Honestly, so if you're vomiting blood or have diarrhea, right. The thing is you got to pay attention to the colors, because internal bleeding it'll come out black. Right. Especially you can vomit, and it'll look like coffee grounds is actually in it, whatever you vomit up. Right. The only thing, my suggestion, go to the hospital right away. Don't wait. Even if you only vomit once or twice, you still have to go. The same thing with the rectal bleeding. If it's black, go right away. Don't even wait. But see, bright red blood just means it's in the rectum, and a lot of times that's from hemorrhoids.
Or tearing.
You could have an anal fissure. Yeah, you could have been constipated. And when you're really, really constipated, it can stretch out your rectum and cause you to bleed a little bit. But like I said, that's why it's really important if it's black.
All right, so theoretically, let's say that we can't make it to the hospital. Let's say something happened and we can't make it. What can we do?
Well, the one thing they're going to do is give you fluids when you get to the hospital. It's going to be kind of hard if you're vomiting the blood, because chances are you're just going to vomit that up, right away. You got to keep warm for shock, of course. The person's blood pressure will drop. Hold on 1 second. 4. Hold on 1 second. Let me get here. Let me see the quickest thing. Okay. So, let's see. I'm trying to find the easiest way to. So, also, another thing, if you're vomiting, someone's vomiting blood, it can also be esophageal varices, and that's from esophagus cancer or an alcoholic from the constant vomiting, and they can also bleed from that. I'm trying to think of here.
Let's think about this hypothetically. So if there is, let's say our infrastructure is gone and we're going through some of these things, what do we need?
Mm-hmm. Okay. Hold on 1 second here. So this is what's going to happen. What you need to look for if this person starts vomiting blood or has rectal bleeding. They will have dizziness, blurred vision, rapid heartbeat. Their breathing will change. They will have cold or clammy skin, and that's just because of the blood loss or fluid loss as well. Confusion.
Some of the same symptoms as shock.
Yeah.
But it's hemostatic shock, right?
Yeah. Confusion. They can faint. Now, if their abdomen is swelling up with blood, it actually, when you feel it, actually you thump it. This is what they do. It sounds like a watermelon.
Well, watermelon.
And that's how you could. Let me see. So I'm gonna start with what you do when you get there. They're gonna do a CAT scan. They're gonna do an endoscopy, which the tube goes up and down. Trying to see complications. Well, that's older adults, history of alcohol misuse, people with a history of a stroke. Hemophiliacs can also bleed a lot, and anemics. I'm just trying to go down here to find out. Hold on. Where to? My internet. Sorry, my internet is decided to just keep going. Let's see, and they will do, and we're going to start with, just in case you do get to the hospital, they'll also do a liver function test too. So treatment of coffee ground vomitus. So it depends on the cause and location of your internal bleeding. So there's going to be possible causes of a GI bleed. And so the first thing that you're going to do is find out why, or the doctor will.
Right.
Like I said, diagnostic tests. I'm trying to find out some because this is going through. I got to go through this from. Okay. So for gastric ulcers, which you can actually have rectal bleeding from this as well, they'll give you stomach medicine, the protein pump inhibitor, or PPI, and that. I'm trying to find out if it's like Nexium or. Come on. Which is, I think it's Pepsid. Yeah, it is. Pepsid, Tagamet, or any of those they'll give you. That can help stop. Okay. Come on. Okay. Also, IV fluids. So usually a GI bleed will stop spontaneously on its own at about 80%. Depending if there's no, let's just say there was no trauma to the body. It could be an ulcer. It could be an ulcer, or anything like that. So I'm trying to see. Well, it doesn't have what to do. Well, basically, it's just treat the person for shock so they don't continue. If you can get fluids in, you sip them because that will help replace the fluid loss. And that's pretty much all you could do because, like I said, aside from IV fluids, and if you happen to be around someone, if you're out in the middle of nowhere and so you fall out of a tree stand and you hit your abdomen and you can't get out, well, you're not going to have IV fluids there. So elevate the feet above the heart. That's the best thing you can do for that to avoid shock. And loosen up the clothes, like the belt, if it's too tight or anything like that, they have a belt on. So,
right.
Now, when my son died, the horn of the saddle, there's a bruise on there was a bruise on his lower right abdomen, but he was bleeding out his eyes, his nose, his ears.
That is called DIC. I think it's called DIC. It's been a while. Where you will hemorrhage completely, kind of like Ebola or hemorrhagic fever. Same thing, but that's also can happen too.
Right.
He lived for a little while. He made it to the hospital, which was about 20 minutes away, and he died before the helicopter could take him.
Oh, wow.
Right.
So if you can't stop the vomiting, if you're vomiting blood and stuff, it will lead to dehydration. You've got to find a way to rehydrate if you can't even get to a hospital. So I'm trying to think. Let's see. Yeah, and they're going to go, like I said, the possible, and you're going to know yourself if it's a trauma or if it's an illness that'll do it. Sometimes you'll need a blood transfusion or get packed red blood cells.
Right.
You'll also get oxygen.
Right. So,
yeah,
depending on the trauma, there's really nothing you can do unless you get to the hospital.
True. Yeah, I mean, like I said, all you can do is, but the thing is, if you can get to a hospital and someone's vomiting blood, don't give them any fluids or anything like that because you could get to the hospital because they're going to be looking in, and if they have to do surgery, that's the whole, you're not supposed to have anything to eat or drink 24 hours before or at midnight before, so, because you don't want to run the risk of aspirating what's in your stomach into your lungs. So
right. So what would be your advice if, like, let's say you're out hiking, right? You're miles away from anywhere. You fall down a cliff. What could you do?
Well, it depends if you hit your head. Honestly, not to be a smart, it all depends on how far you fell. If you have a phone, which is why it's important to keep a phone and let someone know where you're going to be at.
Right.
But honestly, if you can't, the thing is if you can't walk out, that's when you have to put your other thinking on, like if you can make a fire. It depends on what you have with you, like a signal fire. I mean, that's about all I can say about that.
Right. You're talking about signaling somebody for help. So my next question is, okay, so we know that most of the stuff you need a hospital for.
So what if, a hospital isn't available? What do you do?
Do what?
So if the hospital isn't available, what do you do? What do you do for somebody like this?
Well, like I said, there's not much you can do. Like I said, is treat them for shock, and that's all you can do. Because unless you're a surgeon, and you're out in the middle of nowhere, but then again, you don't have your equipment, you don't have anything like that. There's not really much you could do for internal bleeding or rectal bleeding or vomiting blood. But like I said, unless it was a blunt force trauma to your abdomen, it should stop. Like I said, it should stop. The only thing is if you can take fluids, just make sure you can get fluids into you, until you can get to a hospital or even to a road. That's the other option. And hopefully you can get to a hospital. Let's see. I know everyone's different. On the amount of how much blood you have in your body.
Right.
Hold on.
But you got to think about arterial bleeding and venous bleeding and some of the things that go on, like amputations and deep cuts and stuff like that.
Oh, that's what I was. Yeah. I'll get there. But that's all you can do for internal bleeding. That's pretty much it.
So internal bleeding is kind of a different animal. You really need a doctor for internal bleeding. You need a doctor for internal bleeding.
Yeah, you have to. For the internal bleeding, you have to have a doctor. You could even, your lungs can even fill up with blood, and then you get it with a collapsed lung. So things like that is.
So you're talking about you're talking about like hemopneumothorax and things like that where your lungs start.
Yeah, that's the bad stuff. And so there's nothing you can really do. Well, no, for the hemopneumothorax, you can do a chest tube, make an improvised chest tube to get the blood out of the lung. That is it's hard to do. It's not. Let's say.
What is all that background noise? Somebody driving?
I'm driving. Oh,
it's Phil.
But see, with hemopneumothorax, you got to evacuate the blood. But basically, what it is that you're also pulling in atmospheric pressure. Because if you think about it, you're surrounded by one ton of pressure all around you. What's up, brother?
Good to hear your voice.
So the one thing you want to do is relieve the pressure. So for sucking chest wounds, hemopneumothorax, it's kind of a different matter. As long as you can expel the blood and relieve the pressure out of the lungs, then you'll be all right. But some of the things that you can look at to tell is like by your throat. So look at the person's throat. If you start seeing going to one side, then you know that pressure is pushing that lung and all your heart over to that side. So if it's going to the right, the left lung collapses, going to the left, and the right lung collapses.
And it's very painful. And the person will be able to tell you. Yeah, they'll be able to tell you that they can't breathe.
Some of the things that you gotta look at and treat, is being able to know what's going on.
Yeah, and a lot of times, unless you have like a basic first aid kit with some things in it, not many people are going to have stuff to make a makeshift chest tube to relieve the pressure in the blood and everything else. It's like I said, that's why I keep a lot of odd things in my first aid bag. So, but
what you could do as far as like an emergency chest tube, some of the things that we kept in the Army was a piece of aquarium line, that rubber tubing, and then coat it with Vaseline. And put it into
yeah.
a Ziploc bag.
I have oxygen tubing. It could be used for anything, actually.
Absolutely.
I have catheter kits with Foley catheters. I've got those. I mean, I've got all kinds of because, like I said, that's why I like my first aid bag. I could just put. You never know what you're going to need it for.
Right. And then just being able to observe and verify what's going on. That's the biggest key to it.
The other biggest thing is stay calm.
Yeah, exactly.
It's hard if it's just yourself, but you have to stay calm because once you get into that panic mode, that's it. Forget it. Your critical thinking goes right out the window, and it doesn't do you any good to panic. Your heart rate's going to go up even more. So yeah, the best thing to do for any type of hemorrhaging period is to stay calm.
If you're a person that gets if you get kind of anxious or have a high anxiety at the sight of blood, or you're like the type of person that passes out at the sight of blood, move aside, let somebody else take care of it. Because at that point, you're just going to get in the way and you're going to cause all kinds of problems.
Honestly, that's my daughter, my oldest child. She hates the sight of blood. She could do shots, but once she starts seeing a lot of blood, she passes out. Which is why she would never. That's why she can't be a nurse. She just can't do the whole blood thing to her. And I'm like, oh, that's But
hey guys, is the background noise bothering you guys? If not, I can mute it and just listen in because I have to drive and these headphones they pick up everything.
Oh, that's up to you. If you want to mute it, and then when you want to say something, just unmute it and talk.
Well, I don't know if I can do it because I'm actually calling in. See how this works?
Oh.
Yeah. So.
Oh, okay.
But I don't know how loud it is. I can't hear what you're hearing. So does it sound pretty ugly?
No, you're fine. It's just before I guess you had the window down because we heard a lot of background noise.
Oh, okay. All right. Well, let me know if it's annoying, and I'll just let you guys mute me, and I'll just listen in because I'm with some friends, and they. Actually, why don't you guys go ahead and mute me? I'll listen in because they want to listen to music in the car.
Okay, that works.
Okay.
All right. And if I want to be unmuted and say something, I'll text Bobby and have him unmute me. Bobby, you listening?
Okay.
Yep, got you, brother.
Okay, buddy. Thanks, man.
So hemorrhage can occur from either a trauma, a medical condition, or even both. And some drugs may have... Huh? Oh, I didn't know what you said. But some drugs may affect the coagulation pathway and actually cause bleeding. So,
there's some plants that do that too.
Like heparin. If you're taking heparin, Coumadin, or any of those, or Plavix, and so you do have to be a little careful to not, have an accident or whatever. So those are also going to add to the bleeding. Also, aspirin and anti-inflammatories, Motrin, Advil, Aleve, all of those.
Right. Well, alcohol too.
Actually,
so if you're consume alcohol, that'll bleed. It thins the blood, so if you're any turmoil like that, you're going to bleed a little bit more.
True.
Same thing with aspirin, Tylenol, like you said, Cam.
Yeah, and see, I can no longer take aspirin, Motrin, Aleve, or Advil, none of that, because of my stomach. So I can't even take the coated stuff or the gel caps. I've had gastritis way too many times, and I'm not even going to go. No, it's not going to happen again.
Right.
So common types of trauma are abrasions or grazes, like if you fall off your bike or you're walking on a sidewalk and your dog trips you, like mine does. That's we should get a scraped knee, a hematoma or a bruise, and there's different size bruises depending on how hard you hit, lacerations, puncture wounds or animal bites, crushing injuries, gunshots, and fractures. The thing about animal bites, this is just from what happened from my last incident from last year. my daughter's dog bit me because my dog and her just didn't want to get along that day, and her teeth went all the way through my thumb, top and bottom. And I was like, aren't you going to put stitches in this? The doctor's like, nope. Because with animal
because
bite,
it was a puncture.
No. Oh, it was cut open. It was like a big, huge gash because it has to heal from the inside out. And they wanted to heal that way. But what they told me was once the inside becomes granulated, when it all starts to heal up, then they said just take the steri strips. And I used one or two of them, and it closed up. But they have to irrigate it, and it burns. Believe it or not, even normal saline will burn.
The thing about animal bites is infection. So, and if you think about it, to leave it open, this way they can note the
and that's
infection
why
that
it's because and so they normally you'll get antibiotics. Sometimes you might get a shot. It all depends on where you're at, and then a tetanus shot.
Yep.
It's 5 or 10 years for tetanus? 5? Okay.
Yeah, 5.
And I ended up getting one. I was due for one anyway. So, So here, some of these medical conditions can actually cause any type of hemorrhaging. Hemophilia. If you're a hemophiliac, you really need to watch out, like playing sports and things like that, because of bruising too easy, and you could end up with internal bleeding. Leukemia, liver disease, heavy menstrual bleeding. You could have thrombocytopenia or a low blood platelet count. Von Willebrand disease, a vitamin K deficiency, a bowel obstruction, congestive heart failure, tumors, acute bronchitis, endometriosis, and an aneurysm. The thing with the aneurysm, my kid's aunt, she fell, hit her head. Took her to the ER. They said, she just has a migraine. They didn't do a CAT scan. They didn't do an MRI. They didn't do anything. They just said, she got a little concussion, and she got a migraine, and they sent her home. Less than 24 hours, she was back in the hospital on life support because she ended up having an aneurysm, and it ruptured. Right. It was that fast, within one day.
Right.
And she ended up dying from it. So that's why, when especially with children, I always pay. Well, it doesn't matter who you are, really. But every time you ever hit your head, they look at the pupils to make sure they're not, all out of whack. And they check for, the dizziness and everything else like that. Now, if you hit the back of your head, that can affect your eyesight, because that's where the occipital lobe in the back of your head, that's where your vision's at. So that's why.
Well, usually you could tell a trauma to the back of the head by how their eyes are, because a lot of times you'll get swelling to the eyes, and you might get what's called the retina in the eyes.
You could bruise your brain.
Right. So the thing about head trauma, a lot of people say it knocks you out. It does knock you out, depending on the severity of it. But non-severe head trauma is actually pretty painful, and, people can actually die from that. But it's a painful way to die, and they might scream and holler. So. Believe me, I know.
Well, see, this was about 2012, and I had a really bad car accident, and I was head-on collision, and my head hit the window. I mean, that's how hard that woman hit me, and my head hit was it the window or the bar that goes down the side of the truck, and my brain bounced back and forth because I could feel it. And my vision was all off for weeks. And so, that's the thing is, that's why we call it TBI, so traumatic brain injury. You can bruise your brain, anything. Just always pay attention. especially if you start getting lightheaded and dizzy.
Yeah. And see, a lot of this is like internal bleeding because sometimes you won't know until it's too late.
Yeah. I was looking for, I still can't find it. But what we're going to do?
So, you know, like scalp injuries and things like that, you know, your head bleeds a lot. So, you know, the thing you have to watch out for, what you got to prevent from doing is making a light situation even worse, because the scalp and the head injury is going to bleed more than any other injury because, you know, there's less skin.
It's highly vascular.
You know.
Yeah,
right.
It's highly vascular, and
yeah.
head traumas always bleed a lot. That's why people always panic. And they're like, oh, my God, no, just, you know, pressure.
And it might not be as bad. So, you know, you're thinking about triage, you know, you look at a head injury, unless you're not feeling crunchy bone up underneath, you know, you might want to push them aside until somebody that's worse.
Oh, yeah,
worse off.
Especially now, also, have the person lay down, but not lay flat. Like I said, like with a head injury, just have them sit down because you will get dizzy and all that cool stuff.
Right.
But like I said, the average human body has between 9 and 12 pints of blood.
Right.
12 sounds awful lot, but I guess it depends on the size of the person. But this says an average-sized woman has about 9 pints, and the average-sized man has about 12. So,
now if you go to like arterial bleeding, okay, so like the femoral artery, you know, it bleeds 30 gallons per minute. Do the math. You know, if there's an artery that runs up under your armpit, you know, do the math on that because that bleeds 30 gallons a minute. So do the math on those because you have to watch because, you know, you have what is called arterial and venal retraction. And what happens is that once the veins are cut, they will suck up in.
Yeah, the veins, they will retract, especially if they're severed.
Right.
Let's see. Well, here, I'm going to go back. I want to finish up the management of hemorrhaging. So visible blood is the most obvious sign of an external hemorrhage. Internal bleeding, on the other hand, can go unnoticed because your heart is going to just keep pumping blood. It'll just keep pumping that blood until, you know, you can only bleed so much, but, you know, unfortunately. So internal bleeding can be completely asymptomatic or cause symptoms depending on the region. Pulmonary bleeding may present as a hemothorax or hemoptysis, which is vomiting blood. A GI bleed can have vomiting blood or diarrhea. Bleeding in the urine can be a sign of a UTI, or you could have a problem with your kidneys or your bladder. You could also have kidney stones can make you bleed. Now, if you have like an accident and you like your kidneys you hit your kidney really hard, that can also start to bleed.
Right.
So bleeding of the brain can be present with a neural deficit. Minor bleeding wounds require wound cleaning and dressings.
Yeah, so, you know, brain bleed, you usually find out how cognizant they are. If they're very coherent, you know, it might be something slight like a concussion or something, but if they're not very coherent, it may be deeper and internal. And that's something you got to watch out for.
Yes. Let's see. This I'm gonna go into. This goes into.
But usually, if it's that severe, you know, you can feel like crunchy bone up under the skin.
Yeah. So here's the intracranial hemorrhaging. The bleeding within the cranial cavity can cause a hemorrhagic stroke, which is the leading cause of death. Intracranial hemorrhages can be complications of people with high blood pressure, like me and Bobby, and millions upon millions of other people in the world who have high blood pressure. And that's the reason why it's important to keep your blood pressure in check. So the complications of hypertension, it's about 12 to 15 per 100,000 individuals. Yeah. And that includes 350 hypertensive hemorrhages per 100,000 individuals. This is elderly, but my blood pressure can get out of control sometimes. And that's why I've got to keep an eye on it. There's roughly 7,000 surgical operations to remove intracranial hemorrhages in the U.S. every single year. So usually it's males and over 55, usually. Mm-hmm. Not saying it's all, but in younger
you figure
people...
you factor in, some of the things that could cause, like high blood pressure, not eating right, smoking, alcohol abuse, things like that could cause that too. So you might be a young person still have to go through that.
So in younger people, it's an arteriovenous malformation. That's usually what causes the intracranial hemorrhage. So this is a type of, you could have a epidural hematoma, a subdural hematoma, a subarachnoid hemorrhage, and an intracerebral hemorrhage. So the brain has 3 layers, and they're called meninges. So, I know it's getting a little scientific, but, bear with me. It's just like the pia mater, the arachnoid matter, and the dura mater. And the dura mater is the outside part, outermost membrane that covers the brain. So let's see, I'm going to simplify some of this. So the dura mater, that has all your major blood vessels, and then that breaks down into capillaries. Like in your fingers, same thing. You start out with an artery, and it works its way down to veins, and then capillaries. Up to the farthest distance away. Let's see. The middle layer cushions the brain like a loosely fitted sack, and that's where your cerebral spinal fluid is at. So, just say you get a hematoma in your brain, and that's going to push on your brain, and it's going to take up space, and that's where a lot of times you'll get the really bad headaches, the vision problems, and you end up with a lot of cognitive problems, and that's where normally you need surgery, like a shunt or anything like that, to get rid of the pressure off the brain. Also, they can use the blood thinners and things like that to get rid of the hematoma.
Mm-hmm. Right.
An epidural hemorrhage is bleeding on top of the dura mater. That's right below the skull. So that's your skull, and then the epidural hemorrhage is right there on the outside if you have one. So it occurs mostly after direct trauma to the head. So normally you will get a loss of consciousness after a direct blow to the head. Occasionally, altered mental status. You could also fracture the skull.
Yeah.
And this is where, because it's highly vascular, and if your skull happens to tear through your scalp, and that's where you're going to have even more bleeding. So.
Right.
But yeah,
usually
like you said,
sometimes can be pretty fatal. So.
Oh yeah.
If you suspect it, get them medical attention right away.
A lot of times, I don't want to say very seldom. Like when I hit my head, I didn't fracture my skull, but I know I rattled my brain around there a little bit. But if you get hit in the head with something hard enough, a rock, a bat, God forbid if a vehicle hits you, and you can hit your head on the ground, and your head will bounce. Believe it or not, you can hear that thing, and that's usually when you end up with a fractured skull. On that. So patients present after trauma to the head associated with an episode of loss of consciousness followed by a normal level of consciousness, an ongoing headache, and that's called the lucid interval. and that's a duration of lucid interval without neurological deterioration. So you could get knocked out, you wake up, and you're fine, and it's okay. Usually an epidural hemorrhage is generally short, and it could go from several minutes to hours. It all depends on the person and how fast you can get treatment. And here's what happens, though, with a lucid interval, because like my kid's aunt, when she fell, she hit her head. Oh, I have a headache. I'm okay. And they think nothing's wrong. The problem is it can cause the blood clot can get big enough and cause a brain herniation and then death. So anytime you hit your head, it doesn't matter. Always check the person's level of consciousness and how they act. And I would say even 2 days, if they're still, get them to the hospital.
I say within a few hours. Usually you can tell within a few hours.
Well, true, but I mean, like, if you just bump your head, like, I don't know how many, if any of you guys have ever done this, you're, like, reaching under your table for something and you smack your head on the table. Okay, well, one, depends on how hard you hit your head. Something like that, but it all depends if you cut your head open. But, like, with a car accident or something like that, yes, I went to the hospital right away.
If you hit your head and you go unconscious, go to the hospital right away. If you hit your head and you feel dizzy afterwards, go to the hospital right away, because you don't know what kind of internal damage you did.
Yeah.
I remember a number of years ago, I don't know if it was two homeless men, there was some kind of fight. And the cop later on came across one of the men in an alley, and they arrested him, and they accused the cops of killing him. Come to find out, the fight that he had gotten in before that initiated the cops investigating, he had gotten hit upside the head with a baseball bat or something that caused some kind of concussion, and he didn't know it, and then it made him behave totally out of character, because he had been the one that was non-combatant or something, and, so then he was fighting the police. But I remember, because sometimes your head, you don't know, your head is very sensitive, and you don't know. It is. It's not just a question of how hard it hits, but where.
Yeah,
true.
I got to interrupt you guys for a second. So when you're talking about any kind of subarachnoid hemorrhage or subdural hemorrhage, I just want to correct you a little bit on that. You never give a blood thinner, because it's going to make the bleeding worse.
Never give what?
You want to a blood thinner. You said you could give a blood thinner, and you don't want to give a blood thinner.
I thought that's what they gave with.
Not during an active bleed. No, not at all. Actually, you want to get.
Yeah, because it was in the blood.
You want to get vitamin K to actually reverse the thinning properties and have more of a coagulation effect. And then once you get the hematoma formed, you actually want to physically remove the hematoma. You still don't want to give a blood thinner, because you're gonna have bleeding after you remove the hematoma. Then you control the bleeding by cauterizing the arteries. At that point, you can give a blood thinner once the bleeding is controlled.
Isn't that why they say never to give somebody that hits their head and has a headache aspirin, is because it's a blood thinner?
Yeah, aspirin is a very mild blood thinner, and you can give them an aspirin if it's a tension type of headache, and you know what kind of headache it is.
No, I meant if they hit their head.
You don't give them anything. You could give them Tylenol, but you don't give them any sort of NSAID such as ibuprofen or aspirin. Aspirin's considered an NSAID too, and they all have blood thinning properties. But the aspirin what it does is it binds to your platelets, and it renders your platelets ineffective, and you need the platelets to do the clot.
Now, I just remember that because I'm a klutz and I have a tendency to walk into things. And I've hit my head a couple of times hard enough that it hurt, and it was always take Tylenol. You don't take aspirin or Excedrin or anything like that until you know that there's no problem.
Yep, that's true. You're very correct about that. No blood thinners at all for headaches, but you can give a Tylenol if need be. And I remember one time Angela was rendered unconscious by a log.
Yeah.
Okay, Bobby, you can mute me again. I'm going to sit back and listen, but never give a blood thinner or an aspirin or an ibuprofen when there's a chance that you have some sort of bleeding going on, because thinning the blood makes it even worse. Vitamin K would be a little bit better.
So that's a pretty good story, actually. So, and it comes like right into line on this. So anyways, long story short, my older brother, Phil, and my brother Mike, they're two rivals, and so Phil, he picks up a log, he's going to throw it at my brother Mike, but I happen to go around the corner, and I get hit by the log instead, but it knocked me out. So, and I didn't wake up for almost, I think it was like a day, 2 days maybe. So, and what I'm saying is, with a head injury, you don't want to take the chance. Get them to the hospital right away because you don't know what's going to happen.
Oh, yeah.
When I knocked myself out in my car accident, I broke my face with my hand, and I was unconscious. From what I've been told, I laid in the ditch for like 3 hours, or laid in the, not in the ditch, but
oh damn,
yeah, in the floor of the car, in the ditch, and I didn't wake up until they unloaded me out of the out of the ambulance at the hospital, and I don't remember ever having a headache. They had me so doped up, I don't think I even knew my name.
Yeah, I mean, I was delirious. Like, I remember like being some pizza. I remember waking up. I remember a few little things, and then I remember a little bit, and then for a long time, like, I felt like in a fog. So when it comes to like head injuries, always note their personality. So if you're very close to somebody and they hit their head, know how their personalities were, because they're going to have a definite change, especially if it's like severe.
Oh, yeah. But, yeah, and just make sure you know how they are, because that is a big thing, though.
It is a big thing.
Like the whole, I just have a headache. Well, you might have just a headache, but you don't want to take a chance.
Right.
Because, like we said, it could be anything. So.
Right. Going back to getting hit in the back of the head.
Back to my car accident, that's why we don't let men drive. They crash. Two car accidents, and both were men drivers, and I should have been dead in both of them.
Well, that's not funny, but it's,
Yeah.
Now, when you do say you hit your head, it's called a contre-coup. Is when your brain, it'll bounce back and forth in your head. And that's where you can bruise even the frontal lobe or the occipital. You can bruise both, actually.
Right.
And that's what happened to me. And a lot of times, like I said, I was lucky. I was fortunate. I was only unconscious for maybe 5 minutes, if that. I was lucky. But it did mess up my vision for quite some time, actually. I actually had to get new glasses because it affected my vision. And
any trauma to the back of the head is going to affect your vision.
Oh, yeah.
All
is good now.
That's why some people do it, because it's easier to blind you from a hit from the back of the head.
Hey, I know something interesting about head injuries. Did you know that the Aztecs would, when people had severe concussions or head injuries, they had a method of brain surgery, and that a large percentage of them actually survived the hole they poked in their head to relieve the pressure caused by the concussion?
Yeah.
Yeah, they drill a hole. Yeah. They actually still do that in a hospital setting, of course, and they have done that, drill holes in your head, but sometimes they will do a shunt, and they'll put it in from your scalp or in from your head, and it will go back into your body so the fluids will drain. Sometimes I don't know.
I always thought that was kind of interesting that thousands of years ago they had this drill, and of course they didn't have any real anesthesia, and that they even knew back then what to do for people who had head injuries, for swelling and stuff. That was kind of cool.
Mhm. Yep.
I'm trying to. That's what hydrocephalus.
But say you think about it. The head's one of the get hit in. There's certain parts on the head where it can actually affect
your brain is
severely.
in there.
Yeah,
Major organ.
right.
You got to have the brain.
It's actually a painful way to die. Really, getting hit in the head.
So some of these shunts I found so far as some say, well, not how long you stay in the hospital. Some people have had them for a long time. It all depends on, for hydrocephalus, for an illness, 10 years. Some people have had them, but I'm looking to see. I'm looking for one for just a brain injury. Okay. 24 hours, 2 to 4 days. Yeah, see, it doesn't say. Sorry. Thought I'd find it, but no.
But go ahead, Ken.
As long as you have the pressure, as long as you have the swelling in your brain, you'll end up keeping that shunt in there for a while. So I was just looking to see how long they say they keep it, but they're not telling you. So bruises is another thing that it can go with this. So skin is very vascular. This organ, which is the largest in our body, with a surface of more than 2.5 square meters, it has to be supplied by a complex network of blood vessels called capillaries. So they serve to deliver oxygen and nutrition uniformly to your skin cells. And this is the reason why, I didn't know that, why light-skinned individuals, especially from Nordic countries, have a pinkish tinge to their skin. It can also serve to assess the perfusion of the skin as such tinge is replaced with a pale white color. So that has to do with the oxygenation of the blood. So everyone knows you get a bruise and you break the blood vessels that's at the top part of your skin, and the blood will get there and it'll pool up. And sometimes it starts out as black, dark blue, the darker colors. Sometimes bruises hurt, sometimes they don't. So, like I said, bruises form when blood capillaries are injured and blood is released into the skin layers. It's not uncommon, and the skin being the interface of our body into the surrounding environment is very liable to trauma. But the ease of such injury to cause bleeding and the amount of blood released before our hemostatic mechanisms, those which form the blood clots to stop the bleeding. So, trying to see where it gets to the part where it talks about what kind of bruises. I'm like, come on, get with it here.
I have a permanent black eye from my car accident.
Do what?
I had a permanent black eye from my car accident.
You get permanent black eye? It never goes down?
Yep. Yep, there's a black mark on my cheek where my wrist and my cheekbone.
Hey, his music is in the background.
I don't know.
Is that Phil?
It's not my. I'm actually on my way to band practice. The drummer's inside his house playing. I get my hear drums.
That's it.
Yeah, I'm outside the house, but I guess these are good earphones.
Oh, okay.
Yeah. Give me a second. Hey, I just have a question. How come when they say when you get a concussion, they ask you not to go to sleep? That's all wives' tale or what?
Yes, actually. Well, it usually so you don't go into a coma. At least that's
if you're gonna go into coma, you're gonna go into coma. You're gonna go into coma, right?
True. That's very true.
Yeah, but don't they have you keep awake so that they can watch your pupils and stuff? Or if you do go to sleep, they wake you up every 20 or 30 minutes just to make sure?
I think they gauge your orientation, your cognibility. That's why they keep you up.
Well, I've never seen them do that in the hospital, but I've seen like moms do that, and when kid bangs his head real hard, they won't let the kid go to sleep because they think he's not going to wake up. So I think that's a wise tale.
Yes, it is.
But
it's an old wise tale.
But the doctors, when you go to the emergency room, that's one of the things on the list. Not to let them go to sleep for so long and then to wake them up every 20 or 30 minutes for the next 24 hours or something like that.
I know it's like cognibility.
Yeah, I know. And we checked the their scores and all that stuff. So they have to do that every so often. But I think it's called. Is it called APGAR? It's called an APGAR score. Is that what it's called?
Yeah.
Yeah.
Maybe they give it to the parents to make them feel as if they're doing something.
But I can do an eye exam and look at the back of your globe and see if there's anything pushing in on it, as if you were having space occupying hemorrhage in the brain. So a lot of times, just based on the neurologic exam, can determine if there's going to be consequences to a head injury. But
like I said, I'm accident prone, and as a kid, that was one of the things they would always send, instructions home with my mom. And one of the things was always don't let her go to sleep for so many hours, and then wake her up every 20 to 30 minutes or whatever for another so many hours. Trust me, that's something I remember. It was very annoying.
I remember.
It was to have these.
I remember whenever I was in the Hamlets and things like that, they were making me stay up and things like that. I think what that is like some self-care. So if something does happen, they can be able to give, doctors, hey, they hit its head. But I think that's just to make sure that your cognibility is staying kind of the same.
Yeah, and basically what they say when it's okay to go to sleep is if you can carry on a conversation, you can walk without difficulty, and your pupils aren't dilated. And that's one of the biggest. They went from.
I remember advanced medical training in the military, as far as like head injuries go, because sometimes the hell may take 4 hours to get Betty back in because you never know what's going on. And some of that was, you keep registering their cognitive ability because, certain head traumas, their cognitive ability will start to deteriorate as time goes on. And that's something you got to learn to register.
See now,
and Marie, I think Marie, you were saying something about being sent home to the hospital, but you figure medical application as opposed to say 50 years ago as opposed to now is way different.
That's true.
Yeah,
that's true.
Yeah,
I have not. I've not had them do it to me in a couple of decades, but I'm just thinking maybe it had, it has to do with the parent, and like you said, today parents still do it if they haven't taken their child to the hospital. They'll do it, just to make sure.
It's an old wives' tale. Yeah, and at one point that was medicine, but since the modern age, we've advanced so much, maybe not so important anymore.
Yeah, but again, I think if the child hits their head and they go to the hospital immediately, then yeah, you're right. But if the child hits their head and for whatever reason they are not taking them or don't have easy access to the hospital for whatever reason, then I'm assuming
that's the thing. The parents don't want their children to die, so they want to keep them awake. The thing is if the kid was gonna go unconscious, he's gonna go unconscious, no matter how you try to keep him awake.
Well, I understand this. I am just, trying to figure out what was why they would have parents do it and why parents still do it. That was, what we were discussing. And I do know if one of the kids hits their head to check their pupils, and if they're like not balanced, if one is bigger than the other, you put I do remember how to do all that.
Oh yeah, that's. Yeah, blown out pupil is omnibus. It's not a good sign. But if one pupil's dilated and the other one's not, problem.
But we're not doctors, but at least it's a sign that we probably should at least go to the doctor and have them looked at.
Yeah, and you're gonna know because your kid's not behaving the way he normally does.
Right.
Their children's personality.
What if it's not your kid?
Well, that would.
Well, then are you the medical person that's supposed to be tending to that child?
Right.
If you're just a first responder, you're going to call 911 anyway, right?
No, that's what I'm saying. Like I'm saying, if I'm at the park, if I'm babysitting or whatever, and I'm at the park with some kids, I'm going to call 911, of course, but I'm just saying, kids have a tendency to say, "Oh no, I'm okay." It's like, no, let me look at your eyes. Or whatever, and if things don't look right, you're going to call immediately. Otherwise, you might give them a few minutes. I'm just saying that I've seen different behaviors from people, and I'm assuming it's either through ignorance of what's out there or what their parents did, or who knows? They just want to be extra careful. I'm and again, like I said, I was a kid 40 and 50 years ago. Things are completely different.
Yeah, it's totally different.
Yeah, me too. Same here, me too. I was just wondering, I just didn't understand what was the theory or thought behind that. I think it was just parents were afraid that their kids wouldn't wake up, and then also medical people needed continual state. So maybe that's why. Yeah, maybe that's why you guys are right.
They thought, what they thought was that their child would fall asleep and slip into a coma and die. But like you were saying, it doesn't matter. If you're going to pass out, you're going to pass out, no matter what.
Well, see, that was the thing, because I think what it was, because the way medicine was back then, kids would bump their heads, and then a few hours later, just like, hey, I'm tired, I want to go to sleep. It's like, no, don't go to sleep, because, in communities, that's what would happen. Because some of the communities didn't even have a surgeon or didn't even have a doctor. So, you figure that, if kids don't bump his head and then he goes to sleep and he doesn't wake up, it's like, well, I should have watched him, made sure something was going on. Then I could have took him to somebody that might be able to help him.
Well, yeah, the other thing, I'm going to have to go.
All right, Bubba.
If you are looking at a kid's eyes and you're trying to do it like a nystagmus test, you're having them follow your finger left and right, and the eyes aren't equally moving together, and then once they get to one edge, they're bouncing a little bit. That's usually a sign of a headache or head trauma. But if you ever see a kid's eyes bouncing in the vertical, up and down, okay, up and down is a very, very ominous sign. Bouncing horizontal, side to side, anybody have that, or even an alcohol intoxication or some mind-altering chemical. They're gonna, once you pull, their eyes to one side and it bounces a little bit, that's probably something going on that's minor. But if you ever see them eyes bouncing up and down, like in the horizontal, not the horizontal, but the vertical, that vertical nystagmus is a very, very ominous sign. And if the eyes aren't moving equal, as they're moving, you see one move and then the other one moves, then that's an issue. And if you have different size pupils, those are the three main things you look for: unequal ocular motions, vertical nystagmus, and what they call a blown up pupil. So those are the three main head injury things you look for. You see that also with bleed. The blood pressure,
on the brain.
blowing an aneurysm, a hemorrhagic aneurysm just from having too much high blood pressure. But that's all I can share with you guys. I got to let you guys go. I love you. I'll see you guys next week.
Okay.
All right, man.
Take care.
Right. Take care. Love you, brother. It's good to hear from you.
Yeah, you too, bro.
All right. Buddy, love you too, buddy. You take care too, my friend.
Love you too, bro.
Keep hiding.
Happy belated Father's Day, you mothers.
Yeah, you too.
Yeah, mothers. Hey, it's Mother's Day. And you're it.
Okay.
Wait,
But yeah, that was the thing about the doctors always telling the parents to keep it for the first 4 hours. It was keep them away for the first 4 hours, and then check them. And no, at least I know in the last 10 years, this is what was always told to me with my grandkids. They said you don't have to wake them up. Just make sure you can rouse them. Whenever you touch them, they don't have to actually wake up. You know what I'm saying? Just make sure that they're like, leave me alone kind of thing. Okay, they're fine.
Right.
But yeah, that's what they changed to. But rest is important, especially for a brain injury. Rest is very important, and that's why they changed it.
Rest is
from
important for
keeping
any
them awake.
injury. So sometimes you can't get the adequate rest you need, or
no,
some things and you gotta watch out for that, because certain injuries, even relatively minor, can kill you.
Oh yeah, I mean, so basically, whenever someone gets a concussion, right, they can have trouble falling asleep or staying asleep, having a lot of fatigue, or feeling tired during the day. And everybody knows, you don't even have to have a concussion to know this, to have these issues. Like if you have insomnia and you don't go to sleep, you're going to be tired during the day because you're not getting a certain amount of restful sleep. And that will inhibit.
Your thyroid has a lot to do with that too. So.
Well, the insomnia?
Yeah.
Well, my brain just don't want to shut off at night, but if I don't lay down by 10 o'clock or 10:30, I'm up until 2 or 3 in the morning. So
now,
I have to.
I mean, what other types of bleeds are there?
Okay. Let's see. Here it is. Well, I know we started on here. Hold on a second. I got to pull it back up. I lost it. Oh, come on. But bruising, let's just go ahead and go on with, okay, so here it is. I found it. Come on. So, we covered the intracranial hemorrhage. We covered that, the epidural hemorrhage.
We were on.
Well, that's all with the brain.
We can move past.
Yeah, that's all that one. Well, I lost the other article I had. The other.
All right. So what about like bleeding. And,
that's what I was looking for. That's what I was looking for.
Arterial bleeding. I mean, how do you know the difference?
Oh, yeah, we went over that. We covered that. That's what I was looking for. I'm sorry. I got to find that article all over again. But, yeah, you have your venous bleed, your arterial, and such. And then the venous bleeding is the one that causes that's concussion, damn it. Sorry. Like with every heartbeat, the blood will pump out. Also, the color of the blood. Red is oxygenated and blue is unoxygenated blood. Sorry, I'm still looking for that. I saved it because I wanted to finish reading it. And I'm going to find it.
You won't never see blue blood unless, because once blood hits air, you won't never see
red.
that. Right.
Yeah. Once it hits air, that's it. I mean, it's going to turn red.
Right.
Well, now I can't find that stupid.
So what about dark blood?
Well, like your dark blood, or it's almost black, that's the internal bleeding. So that's the dangerous kind.
Right. So what about like arterial bleeding? Because I think the darker the blood, the worse.
Well, your arterial bleeding, you're gonna bleed a lot more.
Right.
Because that's like you got a carotid artery, your femoral artery, your brachial artery, your popliteal, the one that's down your leg. So the thing is, if you happen to, sever your carotid, you're gonna bleed out fast.
Right.
One, because it's so close to the heart, and it's a main artery.
Right.
But it's still going to be, like I said, it depends on if it's going afterwards, already gone into the lungs and coming out, oxygenated or not. I was looking for. Okay, I wonder if this is it. Okay.
Did you find it?
Okay, I found it. So it's a different site, but it's going over the same thing. So Category 1, it's up to 15% of the blood's been lost. No treatment is typically needed. It's minor bleeding, like a nosebleed, a cut, even a dog, an animal bite. If you ever had a cat scratch you, you were going to bleed. You were going to think you're going to bleed to death. Okay, you're not. But a cat.
Cat scratches.
That's cat. That's
scratches are awful. Cat scratches are utterly awful. I'd rather get cut with a knife.
Exactly. So a Category 2 is 15 to 30% blood loss, and that typically means you have to get IV fluid. One is you've lost a lot. It may produce fatigue, lightheadedness, and paleness. A more serious injury or disease process is usually responsible for this type of blood loss. But it can also happen with minor injuries. Now, say you give blood. You losing a pint of blood, okay? That's not even a Category 1 because, God forbid, 1 pint of blood is not 15% of your blood. But that's why they tell you to make sure you've eaten before you donate blood. Because that's a good blood loss, a whole pint of blood. So they'll give you, that's why they give you the orange juice or apple juice, whatever juice, and then a snack. A lot of times it's crackers or whatever, but that's usually what they do to help keep you from passing out.
Right, so your bone marrow can produce blood.
Mm-hmm.
That's your body's going to produce it back.
Yeah, and it reproduces. So,
and
the thing is, your blood it's recycled.
You actually lose blood every day. You just don't realize it.
True. You do. I mean, not a whole lot. I hope not.
No, not a whole lot, but you do.
Well, why I like to I don't mind donating blood is because for me it's like I'm recycling. I'm getting rid of some blood so my body can produce new blood. I mean, that's just, getting rid of it, getting new blood. But you can only donate blood, I believe it's every 6 weeks, 6 to 8 weeks is the earliest that you can give blood. So Category 3 is losing 30 to 40% of your blood loss, and that requires emergency medical attention, and sometimes you need fluids, but you're going to need a blood transfusion. The person may become combative, irritable, confused, weak, fatigued, tired, and very pale. So, because you're going to have an altered mental status. We're using a lot of blood. And when your heart pumps the blood, what's going to happen is it's going to push all the blood to your vital organs, which is your brain is the first place it's going to go, and your core. So it will automatically go to the most vital organs. So Category 4 is more than 40% blood loss, and that's what they consider aggressive emergency medical treatment, where you need both blood transfusion and fluids. And it's a life-threatening condition, and you got to stop the blood loss. You have to, which is why, especially in the military, why they teach pretty much everybody has some kind of basic first aid on how to stop hemorrhaging, any type of gunshot wound. So it's always going to be like a gunshot, well, we're saying gunshot wound or any type of penetrating wound.
Well,
you have to put a pressure dressing.
Well, to
stop it.
I've seen a lot of gunshot wounds. I would have to tell you that they don't bleed as bad as you think they do. The problem with gunshot wounds is it's internal injuries.
Yeah. Well, also that's where you get shot.
Huh?
It also depends on where you get shot.
Right.
If they
hit
an artery,
Yeah, if it hits an artery, of course. But see, you gotta understand when you get shot, a lot of times they'll catch bone, and those bones will shatter, and it'll destroy arteries, it'll destroy muscle tissue, it destroys organs. So, you gotta look at it like this. Most of that blood is gonna be internal, so you're gonna have to keep that blood inside the body as much as you can.
Well, I mean, the thing is, once it gets into your abdominal cavity, it's not gonna do you any good because it has to be in your arteries, your veins, and stuff like that. But you're right. It also depends on what you get shot with. Will depend on how much damage is done. So an individual who is a Category 1 can become a Category 4 hemorrhage if medical attention is not sought out. So and like I said, anytime you have any time of penetrating wound or a gash, a cut, whatever, pressure dressing is what they use to stop it. Direct pressure right on top of it.
Right.
So unless it's on a joint, and then it's kind of hard to do that.
Well, you can do it on a joint. The thing about a joint, you want to go 2 inches above. So you're basically applying a tourniquet to a joint. But usually if the joint is bleeding like that, you're probably going to lose that part of your body. So
probably, yeah. I mean, you can do a pressure dressing
maybe
to
not,
it.
But right. So, Category 1, Category 2, you're going to be able to you might be able to apply self-aid if you understand that kind of concept.
Yeah. Now, people won't need to know. Oh, wow, that was it? Yeah, shoot. But also, like we were saying, if you happen to have some type of wound, the blood thinning medication like the Coumadin, heparin, Motrin, Advil, Aleve, aspirin, all of those, that will make it bleed even more.
Oh, yes. Yeah, you don't want to be drinking alcohol and get shot.
Oh, that's
or get stabbed or cut.
Well, hopefully you're not doing that.
And stay away from garlic.
Garlic?
Garlic is a blood thinner.
Really? Huh.
Yep.
I didn't know
I said, some natural remedies are blood thinners too. You usually can tell if you just start to bruise very easily. A lot of your poisonous plants are non-coagulating. So what happens is that you might have a capillary bleed, but it becomes more pronounced, and it may abscess because it's not able to evacuate the blood in the urgent amount of time.
Oh, I finally found it. Okay. So here, I did find that article on Healthline is where I usually get a lot of mine from Healthline, NIH, WebMD. And I say that quite. I hate WebMD. But hold on, I found it. Hold on a second. So when is bleeding an emergency? Okay. So if the person's gone into shock or has a fever, the bleeding cannot be controlled by using pressure. Now, if you put a pressure dressing on somebody, it doesn't matter if it's a gunshot wound, a puncture wound, I don't care. If they put a pressure dressing on and they're bleeding through, never take off the original dressing. Reinforce it
put a dressing
with more.
over top it.
Yeah.
Yeah, I remember that. It helps to form not a scab, a clot.
Another barrier.
It helps
it to form a blood clot in order to, like a scab.
Yeah. Now the thing is, it's like any type of wound. Like, especially when I do wound care and stuff as a nurse, when you remove a dressing, you're traumatizing it even more. And it takes 8 hours for it to get back to the proper temperature that your skin is supposed to be, that the wound is supposed to be. And it takes 8 hours to get back to where it was before you rip that bandage off. So anytime, like I said, anytime you have a pressure bandage that's bleeding, so you just reinforce it with more and keep it tightened down. If you have to put a tourniquet on it, if the bleeding was caused by serious injury, of course, well, yeah, you got to go to the hospital. If the wound needs stitches, if it's a big gaping hole, of course it's going to need stitches. Foreign objects that are stuck inside the wound, if you have, we'll just say, if you're impaled by something, never remove it. Always keep that penetrating, the object, keep it in the body. You could get it to the eye. Never remove anything that is penetrated into your body. One, it's coming out.
Don't they
cause
say
more damage coming out.
It can also, if you're not sure, it also like stops, holds bleeding or something like that.
Yes.
It's acting like a barrier.
It's a cord.
Right.
It's a cord.
It does to a point, but the true reason is that it causes more damage coming out because you don't know what the penetration is. So, you say you get impaled by a stick, but it has a branch on it that's inverted, and it broke off going in. Well, that inverted branch becomes like a razor sharp thing, and so you might pull intestine out, or you might be able to pull your eyeball out. So you don't want to do that because it causes more damage.
So,
and the thing about you're impaled, you're supposed to, shorten the ends and bind it with the thing still in. If for some reason it has to come out like an arrow or whatever, if it's sticking out, you're supposed to push it through rather than pull or something like that. But whenever possible, you're supposed to leave it the fuck alone.
But but here's the thing:
absolutely.
if it's an arrow, you don't touch it. Leave it alone, and you reinforce it with gauze or a towel, whatever you have. You wrap it at the base towards the body, and you wrap it up, and then you take it and secure it with tape or whatever you happen to have, because that's to keep it from moving.
But Maria, you're absolutely right. You're supposed to wrap it up around it. Now, the thing about penetrating wounds, if the like say with the arrow, for a good example, if it's stuck in the body, you don't want to push or pull it. That's surgically removed.
No.
If it's penetrating out of the body and you had to get it out, always push it through.
Right.
Or if you could take the head off,
you don't want that arrow to come.
Exactly. That's what I'm saying. Your best case scenario is not to do anything more than support it, and so it doesn't move, and then take the person to, a hospital or at least somewhere more secure or whatever before even attempting to do anything. But,
right.
You've got your worst case and best case scenarios type of thing.
Right. So now, if you got to transport somebody like that, if they're impaled, and if they're impaled all the way through, if you can break off whatever the object is as close as you can without causing any more damage. And the reason why is because if they pass out and you have to litter them, you don't want them to be on that side, because at certain points they're probably going to fall on that side. The best way possible is to put them on the opposite side that the penetration is on. But if you have to if it's absolutely necessary that you have to remove it, always push it through, especially if it's already penetrating out of the back or the front. Always push it through the direction that it penetrated. And
God
then
willing,
once you push
I
it
will
through,
never be in that position, but it doesn't hurt to know.
Yeah, absolutely. Push it through and then put a pressure dressing on it. As far as the abdomen goes, you don't want to put you don't want it to cause too much pressure on the abdomen. But the thing is you want to keep the blood in the best you can. If you have to, if it's absolutely necessary. But that's the thing, if it's absolutely necessary.
True. Now, the worst type of penetration wound is it's called an abdominal evisceration.
Yes.
And that's when you're cut big time and your intestines are falling out. I know. No, if this ever happens to anybody, if you have water or saline, you've got to make sure the dressing is wet because you don't want it to be dry. And that's when they tell you you can use saran wrap.
Yeah, I know.
You can use saran wrap to cover it to keep the moisture in. But never, don't pull them out. Just leave them right there on top.
No.
All right.
Yeah.
I know
All
it's
right.
hard,
So for wounds like that, the best thing to do is gently pick up the intestine, put it on their belly, have them lay flat, and bring their knees up, because it now causes less pressure on their abdominals. You want to lay their intestines on their belly, and then you want to apply a wet dressing over top. Don't try to clean them. Don't try to do anything.
Of abdominal wounds.
Yeah, so that's the worst case if they're falling out.
The worst wound I ever dealt with was I was living with these two drug addicts and prostitutes or whatever. Don't ask. And the one was real crazy and suicidal, and she'd been in the hospital a few times, and she came home with blood all over her arms, and she didn't want to go to the hospital, and she had sliced her arm down from her wrist up to her elbow. I mean, it was nasty. I mean, it was I don't know how she missed her artery, but it was nasty. And I could not get her to go. I stitched that shit up. I was like, and that was awful. I used a couple of, real stitches, but mostly I used the butterfly stitches and then wrapped it tight, and then I disappeared for the next few days. It was up to her if she wanted to die from gangrene or take her ass to the hospital. But that was the worst thing I have ever seen. I was like, but I handled it. I was like, I was 18 or 19, and I was like, shit.
But, I ain't going to talk about some of the worst shit I've seen, but I've seen amputations, I've seen limbs blown off,
Yeah, well, you're military. I'm not. I was a kid.
Well, I was a good kid,
I was a naive kid.
The thing you don't want to do is do what you did, because you can cause damage and then they're gonna blame you. So let them do that shit on their own.
Yeah,
you know what I mean.
Well, like I said, I did the bare basics and told her to get her ass to the hospital, and then I disappeared. I was like, I wasn't taking responsibility for that shit.
Too. That's like cuts to the bone. You know what I mean? So like any cut to the bone, take them to the hospital because that shit
I
cuts
think
muscle.
it's a muscle.
Okay, this is before cell phones. We didn't even have beepers back then. I was like 18. You're talking 40 years ago.
Yeah, take on. I mean, midwives could do it. 40 years ago, midwives could have told somebody up.
And these girls were not legal, and my family was a bit questionable, and like I said, I was a naive idiot. What can I tell you? I felt for the girl, did what I could, and booked it. That much at least I knew to do.
Yeah, move the hell on out. That's all you can do sometimes. But, you should think about it. Think about it, right? So all this medical advancement that we got today, what the hell did they do, 200 years ago when they were still fighting with, like, swords and shit? 500 years ago. And they were amputees and stuff like that. You know what I mean?
Spider webs are good to help stop bleeding. Spider webs.
They use chloroform. That's what they use.
Yeah, chloroform, yeah.
Yeah, I can knock you out with chloroform and then do whatever I want to.
Right.
But what did they do?
A
lot of people
What's Gone with the Wind?
When they did that shit.
Gone with the Wind. They show you when they're way back, when you get to the second half of the movie, and it shows where the doctor, the surgeon, they ran out of chloroform, and they were amputating legs and arms and stuff with nothing.
That's right. Yeah.
Yeah, they were up. They were wide awake when they did that. Now, go back another 200 years before chloroform was invented. What did they do then?
Well, that's what I was telling you with the Aztecs with the brain surgery. They were drilling holes in people's heads. It was, some of them were conscious. They didn't have anything to knock them out, and they couldn't be knocked out anyway because they needed to know what was happening.
A stick in the mouth.
Say you're on a survival situation. You're out hiking, and you fall down a mountain, and you hit a sharp stone, and you cut your arm open, and it's bleeding profusely. I mean, what are you going to do at that point? You know what I mean?
I mean, think about some of the stories we hear, like of the guy that his arm, he lost his arm with the tractor or whatever, and he had to save himself. There's still stories like that today. But when I think of these young people today, I'm like, if what would they do? They die. They'd all die.
They would.
Like, look at that BLM situation with when they thought the kid got shot in the leg or whatever it was. They didn't know what the hell they were doing.
They're putting a tourniquet on a scratch.
Right.
No, that's why I say. No. If you saw the video, people, you would like, oh my God, really? The kid was
and that's just one example. Yeah, that's just one example.
Yeah.
They don't know shit. They say, oh, well, we're medics. And then they don't know what the hell they're doing. It's like they became medics from watching TV.
Well, here's the thing. If you don't know how to put a tourniquet on, don't do it.
No, you'll cause more damage. You will cause more damage.
Think about this. If you have to apply a tourniquet, then whatever limb that you apply that tourniquet on, they're going to lose. Plain and simple. Sorry. That's the way it is. Very rarely do you hear somebody being able to save a limb after so long for a tournament being applied.
Correct.
Very, very rare. So
tourniquet is a last resort. I mean, like if your femoral artery is cut or something, you would use, well, I don't know. Could you put a tourniquet up that high? But
nope.
But my point is if an artery is cut, are you willing? Do you want your life bad enough to lose your leg? That's where you would use a tourniquet. Otherwise, cauterize the shit if you can't, put a pressure, bandage on it long enough to get it to the hospital.
Okay, so now that goes back to my thing when I called about venal and arterial retraction. See, now what makes your veins the longest they are is the pressure behind it. So when you sever your arterial or your femoral artery, there's so much pressure that once it loses that pressure, it actually suck up into your hip.
Right.
So what you got to do is you got to reach up in the wound and you got to pull it out and tie it off.
Before the
unless you have
you bleed to death.
Yes.
Yeah, but okay. So what you're saying is even before you put the tourniquet on, you've got to grab that artery and tie it off.
Yes.
Okay.
Yes.
Okay. See, now if you happen to have hemostats, right? If you have a medic bag and you have hemostats, you would use those, and it'll clamp down because that's what they use in surgery, to clamp down your arteries and your veins and stuff. But yes, that's what you have to do.
But if you don't have that, you might have to tie it in a knot. And once you do,
I'd have to tie it in a knot. I have a suture kit. I don't have hemostats. I thought about the needle and thread. I didn't think about the hemostats. So I'd have to tie it in a knot. So would I just use? So would I use the same kind of? Would I use the same kind of knot I would at the end of a thread?
Yeah, absolutely. Any knot there will tie it off.
Right.
Tie it in.
But don't forget, it's going to be slippery from all the blood, so it's going to be hard.
I'm assuming I have to tie off the other end too.
Yes.
No.
Oh, what's true?
Wait. The blood's not. Wait. If it cuts in half, I understand I have to cut off the top end because that's where the blood's coming from. But I got to tie off the bottom half too?
No, because
actually,
there's nothing you can do with that. There's no blood going.
No, it's true.
That's what I was saying.
Because your femoral artery supplies your legs with blood.
No, you wouldn't have to. That's the point.
Oh, that's good. So I only have to worry about doing something disgusting one time.
So the best case scenario, if you can get into a hospital, put the pressure dressing on. Do not pull anything out of the wound. If they got clothes in it, do not do anything because chances are whatever's under could be blocking off the blood flow.
But all this depends on where you are when it happens.
Exactly.
Are you guys alone? Are there other people around? Is there a vehicle around? Are you out in the middle of nowhere? All this is dependent on the surrounding circumstances. So,
anywhere you go hiking is a national park. Okay, so if you're smart, what you're going to do, anywhere you go, it's either controlled by wildlife, National Wildlife and Rescues, NWR, or whatever they call it. It's either a national park controlled by rangers, everywhere you go in the United States. If you go out hiking, you always keep a number in that you can get to. You take your cell phone with you.
Oh, I agree. Trust me, I don't want to do any of that shit. You want to get medical
attention as quick as possible. You don't want to be laying out there all by yourself and you have some kind of major injury because then, your chance of survival goes way down. You always want to look after yourself.
Oh, no, I understand.
You get one life, that's all you get.
On the Appalachian Trail in Virginia that goes all the way down, they have park rangers that actually hike. Each park ranger is responsible for a certain part, and they have radios and they have phones. So
that's every national park. That's every forest. That's every in the United States. Everywhere.
I was in the Poconos as a teenager. I used to do the Appalachian Trail all the time. So, I know that there are lots of stuff around. Like I said. The odds of my ever having to do anything but the bare minimum, if anything, is pretty slim. But it's always nice to know, like the tying of the artery. I never even thought about that.
Yeah, tie it
or
off.
The fact that I have to reach up in there to get it.
Yeah.
So now, if you're going to be hunting, fishing, whatever, let somebody know where you're going to be at. Also,
oh, definitely.
And an estimated time.
Never go by yourself.
Time.
Yep.
Oh yeah.
I have that Life 360 on my phone. I have something called Life 360 on my phone, and whenever I go away, I make sure, my sister is aware, and so that she keeps track of, and if I'm, and I get to where I'm going, I let her know, and, and if anything happens, she keeps it's not that she stares at it all day, but, if something were to happen and go wonky, she'd know, you know what I mean? So, yeah, it's good to, I agree with you, it always let somebody know where you are.
Let somebody know, never go alone.
Mm-hmm.
Everybody thinks you're macho and go out there and do it until something happens and you have to crawl your ass out. Trust me, it's no fun.
Yeah.
It's no fun.
Even had to do. I even had to do. I was riding 4-wheelers, and there was me, my daughter, and my ex-husband. We were out there 4-wheeling. And this one woman was doing 360s in a brand new 4-wheeler, and she thought she was hot shit. And guess what she did? She flipped that and rolled that 4-wheeler 4 to 5 times.
Ooh.
And the 4-wheeler and she was on the ground, and it just went right over her. And it was just her and her husband. Yeah.
Was she alone?
No, she had her husband. So I checked her to make sure, and nothing was broken with that you could see was out of place. And I'm like, look, you need to get to a hospital. I mean, we saw her do it. I saw her do it. She rolled 4 times. I'm like, okay.
Well, I grew up on Long Island. And, and I learned at an early age, you don't go in the ocean alone. You don't go swimming, because of rip tides and stuff. So, and like I said, the Appalachians, you don't go hiking alone. I mean, even on marked trails, unless it's well traveled, unless there's a lot of people that use it, you don't go on it. You don't go by yourself ever because you never know what's going to happen.
Here's the thing about marked trails. So you might have 20 people out there hiking, but chances are it might be a day before you're discovered.
Right.
So, you don't want to go that day, so you always want to have a backup plan. So, like me, I have a GPS that I take with me, but it also serves as a tracker. So all I got to do is tie into the ranger station frequency for every marker I go to. And if something happens, I can call them. So you always have to have a backup plan, So, but first, ensure your own survivability. Make sure you know that you can take care of yourself. So if something does happen, because it can, make sure that you are able to first take care of yourself and then B, get help to get out.
Well, like I said, I'm very accident prone. So when I was a kid growing up, I made an effort to learn at least basic first aid, and then I had my first aid every year, not every year, every 2 years or whatever it is. I'd go for my what the heck is that Red Cross first aid crap that you get? Yeah, I went for that all the time, and I was a lifeguard for a while when I was a teenager. So and babysitting and whatnot. So they always send you to the first aid things where you learn, basic stuff. And, I was a home health aide for 20 years.
I remember at the YMCA.
Yep.
They taught CPR and first aid class at the YMCA.
Yes, CPR and all that stuff, yes. But,
people should have all of that done.
Yeah, but
to know your basic first aid. Everyone should know basic first aid.
But they used to, but they don't anymore.
No. It's life skills that people went away from because, it's not that dangerous no more.
Well,
whatever.
No, I'm not going to comment on that. That's another conversation altogether.
It depends. I think if you think about the United States, it's not as dangerous as, it was 40 years ago, 50 years ago, if you think about it.
Well, that's true. But, but that's because they got kids all wrapped up in bubble wrap. They don't go outside and play the way they used to. I was in the emergency room all the time when I was a kid. I remember one time going for a bike ride, and
They don't have records of what stupid shit we did. There's no record of it, except one time. One time, and there's two. When I was 5 years old, I was walking in a parking lot on the curb, and I fell and busted my knee. That's one time. And the other time, we were at the park, and somebody had broke a coffee mug and threw it and left it in the grass, and I stepped on it. So from my heel to my toes was split open on the bottom of my foot.
I got you beat.
Yeah, I did that too.
I got you beat. I walked through a glass window. Only my head went through. I was sitting there with my head through glass. Right. Yeah.
Yeah.
Because they don't do that anymore.
But see, kids are going to get hurt. You know what I mean? The thing that I've seen is that kids will get hurt and parents will go overboard over everything.
Right.
That's the thing.
And they don't play as much as they used to. They don't play as risky stuff as they used to. I was sitting in my bathroom once, and my mom took gravel out of my knees with oil covered in oil because I'd ridden my bike and fell off and scraped my knees through the oil where the guy worked on his car, and the iodine and all that.
Maria,
they don't do that shit anymore.
Listen.
Mercury chrome, everybody knows what that shit is.
Mercury
it sounds like a bitch,
Yeah, mercury chrome, that's it.
Listen,
mercury chrome,
Maria, there's a reason why this generation will have no clue. We ran with scissors, we ate paste, mud pies, rode without seatbelts, ran with scissors. I swear to God, we did, and we're still alive.
But I don't think so. I think they do some of the same things that we did when we were kids. I mean, granted, it's not as much freedom. We did, they don't ride in backup pickup trucks. They don't ride.
No.
Yeah,
they don't
free range children
with the fucking window down and the damn tailgate lit. They don't do that shit.
3-minute warning.
That's you're saying, 3-minute warning.
I mean, yeah, granted, they don't do the same things that we did, but they still go out there and they get hurt, they injure themselves, Some of them are smart, some of them are dumb. I mean, we had the same thing when we were growing up, the dumb ones didn't make it and the smart ones still alive.
Exactly.
I mean, I hate to say it like that,
bottle
but
rockets.
True,
No, we held bottle rockets in our hand and let them take off out of our hand.
Yeah, we used to have
go ahead, Bobby.
wars, pellet gun wars, BB gun wars. I mean, ain't nothing like getting shot with a pellet gun. They were
all right, everybody.
Paintball.
We got to bring the show to the close. We're down to 1 minute.
Go ahead.
And just like to say, it was a great show, a lot of participation, and I enjoyed it. Thank you for everybody that got on here with us tonight. God bless y'all. God bless America, our children, veterans, first responders, troops, and God bless the Defender 7. Good night, everybody.
Good night.
Good night.